Bowe. Michele is the ambassador to Palestine for the Order of Malta. And Ambassador Bowe is the president of Holy Family Hospital of Bethlehem Foundation and has recently returned from a diplomatic trip and visit to the hospital. Ambassador?
Good evening, everybody. Thank you so much, Michael. That was just absolutely moving, and it felt like a little mini trip right back to Bethlehem. So as we all know, the pandemic struck in March of 2020 at a time when Bethlehem was bustling. There were 500 tour buses entering the city a day. The line to the grotto extended all the way out past Manger Square and into the market. The future was looking so promising. The Franciscans worked with the other Christian religions and they got the hours extended at the Church of the Nativity. Things were really looking wonderful until COVID was discovered and everything closed, including the checkpoints. I recently returned to Bethlehem, and what I found was a dark, impoverished city. Dark because not much electricity. Closed markets and closed stores. Even the churches were closing at 1 or 2 in the afternoon to try to save staffing and electricity. Can you imagine young families without incomes for 17 months? Beggars are in the streets now, and that's really not part of the culture at all. But they have no choice. Who could deny a meal to a hungry child? What parent would do so? Middle-class families are selling their cars and selling their household goods for pennies on the dollar just to buy groceries. There's no stimulus checks because the government doesn't own the currency and they can't print more to offer stimulus checks. They can't turn to the church as much because the church's revenue depends heavily on the pilgrim hotels and the pilgrim restaurants. And the growing poverty means that those without salaries are very heavily relying on those with salaries. And the ones with salaries are the ones at Holy Family Hospital and Bethlehem University and some of the other Catholic institutions. People are gathering for birthdays with their families, gathering in song, but without presents and without cake. Most people say it's the hardest time there since 1948. And as a reminder, Bethlehem is the poorest governorate in Palestine after Gaza. And I think we forget that because it's so Christian. It almost sounds hopeless, but instead, I was greeted by great joy. Everyday conversations there continue to be sprinkled with, thanks be to God, God is good, and if God wills it. Faith remains strong, and the people are the most resilient I've ever known. As I entered the hospital, I felt even greater joy than ever before. Not only joy of new life, but also the joy of young couples going home with newborn babies and their dignity intact. Thanks to you and other generous donors from around the country and indeed around the world, our Poor Case Fund is covering medical costs without saddling families with debt. We just heard of a man from Slovakia who had a birthday party, and his friends all made donations to the hospital. And they just saw something on social media and were moved by the story of Bethlehem. And by the way, who couldn't be moved? So our Poor Case Fund is covering those costs. Our staff continues to be so cheerful. I know you saw it in the pictures, the smiling eyes behind the masks. And they're working hard to hold up the morale of everyone. But they say it comes easily as they work in the birthplace of hope, delivering life and restoring health. Our hospital shines brighter than ever before, partially due to increased sanitation procedures, but mostly thanks to hope. Hope that stems from the dignity afforded by Holy Family Hospital, not only from greatly subsidized and free health care, but also from high quality employment that keeps Christians in the Holy Land and the training opportunities that gives everyone a chance to better their lives. Holy Family Hospital invests in the future, and you're investing right alongside us. Thank you. Thank you for joining us and hearing the cry of the poor from Bethlehem.